A three-day workshop to introduce the multi-dimensional approaches to poverty eradication has convened in Dominica at the conference room of the Windsor Park Sports Stadium. The project, which was launched in 2015, targets 5 OECS member states and is supported by the United Nations Development Programme, the Chilean government, and the government of Dominica. Project focal point and social planner Dr. Kira Paul said the aim of the project is to support the introduction of the multidimensional approach, which has been promoted since 2010. Paul explained that the project has 3 main outputs.
One is community-based capacity building, and that is to ensure that there's training at the community level so that they can increase the participation of vulnerable persons in the whole economy, and whether also, well, both social and for both social, and economic benefits. There's also community-based advocacy strategies, and in that, developing both information, education, and material. And one of the outcomes of that was the development of community plans, so that there's inclusion of vulnerable persons in the decision making at both the community, national, and regional level. And the third output is the development of relevant qualitative data collection tools, and this is one of the activities why we're here today, so that the information can be used to inform poverty reduction projects.
Historically, poverty has been measured using income-based indicators. However, this multidimensional approach promotes the idea that poverty is more than just a lack of income, according to Paul.
Persons living in poverty are often deprived of material. It's not only financial, but they're also deprived of material and social resources. And sometimes it happens all at once and not necessarily in isolation. So multidimensional poverty is made up of several factors that constitute deprivations experienced by persons living in poverty. And so these deprivations we talk about poor health, lack of education, inadequate living standards, lack of income, disempowerment, poor quality of work, and also threat from violence. And one thing that is missing here is the vulnerabilities faced by climate change.
The multidimensional approach is measured using the Multidimensional Index, a score which reports the percentage of the population for a given society that experiences 3 or more deprivations at the same time. Multidimensional poverty is experienced as a result of poor health, low living standards, and a lack of education. Paul indicated that the 3-day workshop is focused on building capacities around participatory action.
The PAR, which is the Participatory Action Research Methodology, aims to enhance interpretation and the use of data, using narratives capturing the lived reality of persons who experience multi-deprivations. It also seeks to raise awareness among the poor and stakeholders who work with them, and most of us are represented here too, of the need for a new approach to policy, program design, and social service delivery that will better respond to the needs of persons experiencing multidimensional poverty.
Dominica, Antigua and Barbuda, Grenada, St. Lucia and St. Vincent and the Grenadines are the 5 participating countries. In Dominica, the project is being piloted in Bagatelle, Silver Lake and Woodford Hill, as well as Sinico. The project is expected to end in December of 2017.